what generally happens is people who take the worst option down here because it becomes a commodity. You're like, I'm not going to like it, I just want to get as much as I can for the money. Cannabis, premium quality craft cannabis is not a commodity. Hash was a commodity. It's fairly ubiquitous, although there's different regions, different qualities, but there's such a vast difference in the quality in cannabis. You have to see this as a segment of the market. So if we look at the price divided by, or sorry, the value divided by the price, you get your relative value to price, and you can see that's the best option, obviously. But when you take away the 8, that is the worst option, and actually that one is the best. And if you do this repeated enough times over people, statistically, you do get those answers. Most people want the good cookies when available, but if you take that option away, they go down there, and it's not surprising because you've got the best relative value to price equation. So we've got the 3 types of quality. We've got physiochemical, physiological, and physical. Now, cannabis is a pharmaceutical product. Not like Canada where you're allowed to have it. It's like Uncle Jesse's whiskey and the Dukes of Hazzard, kind of a wink and a nudge, medicinal, but not really. No, it is a full-on pharmaceutical product over here. The problem is, it's not like most pharmaceutical products, which are single compound synthetics derived from chemical synthesis or purified plant extracts, which have gone through microfilm distillation and that. And again, you're working down to a single molecule, and you can cleanse it, you can sterilize it, you can do all sorts of stuff with it. We're talking about a plant. You can't clean it. Your quality is how you grow it. And effectively, the active compounds aren't inside the cannabis flower. For anyone who hasn't seen it, there's these trichome heads that look like little glass mushrooms all over the flower. Inside that bulbous head is where all the active compounds are made. So your cannabis plant is the pharmaceutical facility, and all of the light, the stressors, the things that the hormonal responses of the plant are going to make the product. Once you cut it down, you're finished. You can ruin it, but you're not going to make it much better. And that is the biggest problem right now with pharmaceutical regulations, is they don't take account of physical quality, and they should, because all of the WHO guidelines on a very high level talk about whole plant pharmaceuticals. I think countries in am I going to say this right? Ayurvedic medicine is very big in sort of Asian countries. Ayurvedic? Yeah, you said it. There's lots of guidelines for herbal pharmaceuticals. We just don't use them in the West because we like pills and stuff, and that's a huge problem with cannabis, and we're going to look at that now.
My understanding of the regulation is that they don't like to regulate compounds. They'll regulate a chemical. So if you know, like a paracetamol, like a single thing.
The framework is geared towards that. However, there are guidelines for whole plant herbal pharmaceuticals, and they do talk about multi-compound. Yeah, they do talk about the multi-compounds, and they talk about your secondary compounds. If they're psychoactive, then they're active markers. If they're just things that identify different plant species from another one, then they're analytical markers. But they should all be measured and controlled during cultivation. So the UK and the EU regulators have pooped the bed on this one.
Yeah, I was just going to add to that and say that, you know, we're not just talking about a couple of compounds. We're not talking about 3 or 4. We're talking about hundreds of compounds, right? So I think it was 117 known cannabinoids currently.
Yeah, and you're not even talking about the terpenes. You know your stuff. We should go downstairs
I co-founded 2 companies in the industry, so we'll have a chat later.
We should do, yeah. You're still alive and you look young. How did you do that?
My hair got thin. It was all during COVID. Fun stories. Anyway, long story short, there's a lot of compounds. And from a pharmaceutical perspective, right, how do you actually control in a study that it's actually A, B, or C, or whatever compound that you're actually administering causing the effect that you're measuring, right? And when there are hundreds of things in the plant, that this plant has so many different things in different concentrations, how the heck do you prove that it was...
I'll tell you how. Yeah. Control the grow. Control the grow. Yes. You have to know what's in your products and make it consistent and reliably the same spec, because otherwise the data you get back from the patients isn't worth anything.
But I'm talking from the pharmaceutical perspective, not from the, let's say, the control of product perspective.
Oh, for
and
sure.
From the pharmaceutical perspective, if you really want to have a pharmaceutical product, you know, how do you know that it wasn't actually something else that you're not putting a health claim on, or something, right? How do you control for things? When there are hundreds of compounds, it becomes ridiculously complex.
I think that's what I heard, which is that if you you were going to do the test, if you're going to do the test or the experiment, how do you prove what created the result that you were looking for? And because you can't prove it, you can't legalise it. You can't say, here's what he does.
So let me respond to both of these, just
Yeah.
because we'll go off. I'm neurodiverse, so I don't want to go off on a tangent here.
Sorry.
No, very quickly. Honestly, I don't care about medicinal weed. I want to sell the best weed in the world. It will be adult use. This is a segue.
Yeah.
The medicinal market is a segue, and it's Jersey's chance to carve out a brand for premium quality before adult use comes across Europe, because you're going to get oversupply and price compression, and the only defense in that space is the brand for quality.
Yeah.
So the pharmaceutical markets are an opportunity to position our island, and the pharmaceutical framework, I like it because we can insert a signaling mechanism and we can use it to save the industry. No one's ever going to do clinical trials with something that people grow in the backyard, and I don't care about that. I do care about medicine, and it is medicinal, but I also care about the island and our future GVA, and I know what this can do for our economy over here. So it's business.
And there's no incentive to actually do the clinical trials, because what are you able to
Thank
even
you.
patent? There's so many risks, because you go to Colorado and every doctor's already sold every single combination of cannabinoids and terpenes that they've mixed together. And how do you prove that something's new? The risk is so high. You can't because.
But what you can do is make an amazing product, because you know this stuff. Once people have tried the premium quality craft, they don't want to go back to the rest. Now, going back to the pharmaceutics, there are problems with this. I like the regulatory framework if we put the signaling mechanism in, but this is what happens when we don't. So we don't measure the physical quality of cannabis flower in Europe and the UK, and we let companies grow moldy shite, pardon my French. I mean, some of these plants have more pathogens on them by weight than cannabinoids. If you took these plants and shook the mold off of them, you'd fill up a petri dish. But it's okay, because we don't measure physical quality. We measure certain toxins, certain